Hi there. I'm Jen Henderson, and I'm a clinical counselor with mental wellness and substance use services for the government of Yukon. And today I'm going to be talking to you about anxiety. So, in this video, I'm going to be talking about what anxiety is, why we have it, when it's a problem, and actually how it can be helpful sometimes. So, let's get started. So, I'm going to introduce anxiety, and then in a few moments, I'm going to talk to you about more about where anxiety actually came from, and I'll give you a better description, hopefully, as we go along. But in general, what I want you to know is that anxiety is actually about the future. It's the anticipation of a future threat or a prediction of danger. And when anxiety happens for us, it's not just, oh, I feel a little bit nervous or I feel a bit worried. It's a whole bunch of things happening at once. So it includes a bunch of physical reactions, which we're going to talk about, a lot of different emotions, actually. Our behavior changes when we're anxious, and there's a whole lot of thoughts. So, in general, that is what anxiety is. So, it happens, it can be 1 minute from now, it can be a week from now, it can even be next year, but it's not something that has happened usually in the past, and it doesn't usually happen right now. So, if we're thinking about, a bad or upsetting experience that happened in the past, we might be referring to something that was traumatic. There is some overlap, but there is a slight difference. So if we're thinking about something that's happening in the here and now that's actually terrifying or really dangerous or frightening, we actually call that fear. Fear is what's happening in the present moment. But anxiety is something that's happening a little bit in the future, like I said, in a minute from now or a year from now, even. I'll describe that difference a little bit more as we go along. But think of it that way. Anxiety is about the future. So, to think of an example, if I am outside and a grizzly bear is charging towards me, I'm going to feel fear. That's happening now in the present moment, and I will feel fear. But if I'm going out to pick berries, I don't see any bear. I might still have some thoughts about maybe running into a bear, and I might actually feel anxious. So that's how anxiety is in the future. So I'm out there picking berries, and I have this thought that something might happen. It hasn't happened, probably won't happen, but my thoughts are going to be thinking about the possibility of a bear. And that would be an anticipation of this future danger or future threat. Hopefully that makes sense. So let's talk a little bit about why we even have anxiety. I feel like we need to go backwards a bit before we can really understand what anxiety is. So I think what's really important to know is that anxiety actually evolved from fear. And fear has actually been necessary for our survival. It's really a primal emotion. Our body reacts in a very specific way when we're presented with danger. And that evolved for a specific reason. It evolved to keep us alive, basically. So if we think back to, at least a few million years ago, the Stone Age and saber-toothed tigers, in those situations and in that time frame, we either had to fight that saber-toothed tiger or we had to get away from it. And so our brains and our bodies were designed to keep us alive, to keep us safe. We didn't have time to sort of contemplate, I wonder what I should do. This saber-toothed tiger is coming towards me. I wonder what I should do about that. No, we were designed to react first and ask questions later. And that actually kept us alive. That's why we're here today. If we didn't have fear, we wouldn't have kept ourselves alive. We wouldn't have had offspring, ancestors, and we would have become extinct. So fear is super important, has been super important for our survival as a species. We need it. And really anxiety has taken off a bit from fear. They're connected. So let's dig even a little bit deeper into our brain. And again, I think this is really important so you can understand why anxiety can be helpful sometimes. So let's take a look at our brain. This is a really simplistic drawing of a half of our brain, sort of a cross section. And we call this the triune brain because there are generally three parts. So we have a lot more parts and structures in our brain, but this is three different parts in a nutshell. So if we look at the brown part, that's the reptilian part of our brain. That was actually the first part of our brain that was developed. And we often refer to that part of our brain as our lizard brain. So within that structure, we have some of our basic things that we need to keep us alive. So we have our brain stem, that roundish structure in the back. That is the cerebellum. That's responsible for movement. And that whole area is responsible for things like breathing, temperature, heart rate, those basic functions to keep us alive. So you can see why that part of the brain developed first. So moving up from there, we have the red part, which is the limbic system. Now that area of the brain is found in humans, of course, but in mammals as well. And that part is responsible for things like emotions, social connection, but what's probably most important in that area, two specific structures that are ultra important. And those are the amygdala and the hippocampus. So the hippocampus is what stores memories. That will become important in a second. But first, I want to tell you about the amygdala. So the amygdala is kind of like two almond-like structures in the brain, in the central part of the brain. And that is kind of like, that actually is your brain's security system. It is your brain's smoke alarm or even high-tech security system. And that thing never shuts down. It is always working. And it's a good thing because we want it to work, because we want to stay alive. And so that part of our brain is always working. It doesn't go offline. It's always looking for threats. And it often consults with the hippocampus, which is connected to our memory, and it checks it out. And it's like it detects a threat super fast. So 12 milliseconds is when it notices a threat. And then it quickly checks it out with the hippocampus, that's the memory part. And it says, did anything like this happen before that wasn't good? And if the answer is yes, then what happens is it sends a message to that lizard part of our brain very, very fast. And our heart rate starts to increase. We might even get ready to, we might jump or start moving. So it kicks our body into high action to prepare to either flee from danger or maybe even fight danger if we have to. So that's important to remember, this security system, the amygdala within our brain. We actually, we need it to work. And anxiety is connected to that, always kind of looking for threats. If we don't have it, people who don't have their amygdala working effectively don't feel danger. And that can be a problem. So the other part of the brain that I want you to know about is the blue part of the brain, and that's our neocortex. So that is the newest part of our brain. It evolved the last, and it's only found in primates and in humans. So that part of the brain is responsible for things like thoughts, language, imagination, consciousness. There's also a part of the brain, in the front part of our brain, that's also responsible for organizing and planning. So, what that part of the brain does is it kind of it's kind of like the watchtower. It kind of looks down from above and is sort of watching from danger, but from a distance. And it can see and it can think, and it responds a lot more slowly, but it's sort of more meticulous and calculated, I guess. And so what happens sometimes is a threat might come into the central part of the brain, the amygdala, and you might jump. Let's say a smoke alarm does go off. Smoke alarm goes off, the threat comes in, and you kind of jump or react because that's what our body is kind of designed to do. And then what happens is the message is sent up to the neocortex part of our brain, and it says, well, wait a minute here, we actually don't need to run out of the building, we're actually safe. Do you remember that message that we got this morning letting us know that there was going to be a fire alarm test? Oh, yeah. Okay. I remember that piece of information. Therefore, even though I jumped and responded quickly because maybe I thought there was a fire for like a teeny second, oh, yeah, the other part, the neocortex part of our brain, actually the wizard part of our brain, we sometimes refer to the neocortex as the wizard because it tends to be a bit smart. That part of our brain says, no, 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 settle down. You don't need to do anything. So, all these parts of our brain are important, obviously, to make us who we are, but they keep us safe. And as I go along in a moment and talk about some of these physical reactions that happen in our body when we feel threatened, I'll probably refer back to this because it might make a bit more sense then. So, all of these parts are within us and we need them. Okay. So, in general, anxiety happens when our brain thinks we might be in danger. And of course, this can be a physical danger, like I was referring to the bears. That would be a physical threat. But it could also be some kind of emotional threat. So it could be just somebody coming up and talking to us. That might feel pretty threatening. Or it could be, um, yeah, having to perform in some way, to give a presentation, and wondering, what are people going to think? Are they going to judge me? Are they going to think what I'm doing is dumb or stupid or not very good? That would be an example of an emotional threat. So anxiety can occur in both of those situations. We're hardwired to respond to physical threats. But the way we live today, we're not presented with the same amount of physical dangers that we would have been millions of years ago. But it doesn't matter, our body is still wired to respond regardless. So let's just take a closer look at what anxiety really is and what actually happens when we feel anxious. And I think these things are important so that people understand when there's things happening in their body, how it's actually connected to anxiety. Okay, so essentially anxiety it's an emotion, but sometimes people use different words to describe their anxious feelings. So sometimes people will talk about worry, they'll talk about stress, feeling nervous, fear, panicky, feeling overwhelmed, dread, uneasy, or apprehensive. So those are just a few, but there are a lot more emotions out there that sometimes people connect with anxiety, but that's just an example. So when we're feeling that way, and when we feel that there is some kind of threat that's going to be happening in the future, again, it could be a minute from now, it could be in the moment, I suppose. What happens is a whole bunch of physical stuff happens in our body. It triggers this fight, flight, or freeze response. So when we're presented with danger, our body is designed to either fight that dangerous thing, to flee or run away from the dangerous thing, and sometimes we freeze too, which is not always effective, but sometimes that's the only option that we have. Or sometimes we freeze in situations until we can figure out what's the next best option, which would be either fight or flee or fight. So when there's a threat, one of the things that happens to all of us is that there's an influx of hormones in our body, specifically cortisol and adrenaline. And those hormones activate a series of other reactions in our body. So automatically, our heart tends to race a bit faster and we start to breathe a bit faster. And the purpose of that, of course, is to pump more oxygen in our blood so that we can run away or fight danger. That's the purpose of it. The other thing that happens sometimes is that people might end up getting, feeling kind of dizzy or lightheaded. You might even get like tingly feelings in your fingers or toes, or even numbness, or actually even the lips sometimes. And the reason for that is that it's the increased oxygen in your body. You have more oxygen and actually not enough carbon dioxide. And so that creates a bit of that dizziness or lightheaded feeling. So that's just what happens sometimes with anxiety. The other thing is that our muscles can get really tense. So it could be, these muscles here, it could be your arms or your legs. And the purpose behind that, of course, is your body is tensing to get ready to fight or to run. Of course, if we're holding on to that too long, that's going to cause some pain in our body. But there is a purpose behind it. We're getting ready to protect ourselves. The other thing that can happen during this fight or flight reaction is that we can get kind of sweaty. And the purpose of that is to cool our body down so that we can be more effective. Okay. Another thing about that is that So another thing about getting sweaty during this fight or flight response is that it can kind of make us slippery. So if we think again back to the Stone Age, if an animal were to grab onto us, we might be able to slip away. Biologically, that's the reason for it. So the other thing is that we can have cold hands or feet, or sometimes our face can be really pale when we're anxious. And the reason for that is because blood is constricting in all these small blood vessels. So it's not important to have lots of blood moving throughout our extremities. What we want to do is to increase the blood flow to our large muscle groups so that we can fight or run. So that's why sometimes people look pale when they're anxious, or they do have cold hands or feet. Our vision can also change when we're anxious. We tend to zero in on the threat, and sometimes then it's harder to see the broader perspective. So we might not take in everything, or we might not feel like we're sort of paying attention to it all, because we can't. We're just focusing in on the main thing that's causing us a problem. The other thing is that we can get a dry mouth when we're anxious, and as well as actually nausea and an upset stomach. And all those things are actually interrelated. And the purpose behind that is that our digestive system does not need to work when we're activating this fight or flight response. So the whole digestive system kind of shuts down or stops, and it can cause some problems with your gut. It can cause problems with your gut, and you don't salivate. So that's why you get a dry mouth. It's not important to digest food when you're fighting or fleeing for your life. So that's why that happens. So when we feel nervous, we have to give a talk or something, we have a dry mouth. There's a reason behind it. So I guess one thing that's actually connected to that is sometimes we have bladder or bowel issues connected to anxiety. And again, that has to do with the digestive system not working properly. And we also might have racing thoughts. We're trying to like quickly figure out what we need to do in this fight or flight response. And sometimes it's hard to sort of think clearly. So there are a lot of physical things that happens when we're feeling like we're threatened in some way. And again, the threat doesn't have to be physical. It can be some kind of emotional or a psychological threat. It can be a friend. It could be um, it could be your peers. It could be your supervisor. So, along with physical reactions, our behaviors often change with anxiety too. So, sometimes we might feel more restless or fidgety. There might be a change in our habits. Maybe we'll go going back to old habits that we thought we had stopped, or we might be biting our nails or picking at things. Uh, Maybe smoking more. Our sleep is also affected by anxiety. Most people with anxiety do not sleep well. Sleep tends to be affected by anxiety. Usually, sleep is kind of restless or disrupted, or it's hard to fall asleep, or you keep waking up. It's connected to anxiety. Our appetite also changes. If we go back to these physical reactions, if we think about all the hormones kind of running through our body, often when people are anxious, there is a change with their appetite. So either you don't feel hungry at all because your body doesn't need food in that instant to run or to fight the saber-toothed tiger. So you don't feel hungry. And then again, sometimes people have the opposite reaction where they tend to eat a bit more when they're feeling anxious. Again, your concentration, that can be changed. You often have low energy or you feel exhausted, probably because of all these physical reactions that we just talked about. Another behavior that's quite common with anxiety is procrastination or avoiding. So, kind of delaying or putting off the thing that you need to do, or not doing the thing that you need to do at all because it causes too much stress and anxiety. Those are extremely common behaviors with anxiety. You might also see a change in your substance use. So you might be drinking more or using drugs more to dampen down those distressing feelings. So that can be pretty common. You might also have some emotional outbursts. So, you might be yelling or screaming or getting angry and kind of like flipping your lid sometimes because your body is geared up and ready for a fight. So sometimes it doesn't take much to kind of, flip that lid and have a bit of a outburst. We also might be impulsive sometimes. We might react without really thinking. We might spend money that we shouldn't have if we had consulted with that neocortex part of our brain. So that can happen. There is a lot of behaviors that go along with anxiety for sure. And we're going to talk about that actually in the next video, how we can change or pay attention to some of our behaviors. So finally, a huge area for anxiety is our thoughts. And I'm going to talk more about our thoughts in another video. But for this one, what I want you to know is whenever you're feeling anxious, the thoughts are almost always negative. They are not accurate. They are a bit distorted. You're kind of not looking at the situation accurately, even though you think you are. Our brain can kind of trick us sometimes. And so some of the common thoughts that people experience when they feel anxious are, assuming that something awful or dangerous is going to happen, either to, yourself or to other people. That's extremely common. And then another one that's really common, another thought, is thinking that you're going to be embarrassed in some way, you're going to lose control, or you might actually die. Again, extremely common for anxiety to have those kinds of thoughts. And finally, another type of common thought for people with anxiety is thinking that you're going to be judged in some way, that people are going to look at you and think that you're not good enough, that you're flawed in some way, or defective or inferior. Those kind of thoughts often go hand in hand with anxiety. So, that's what goes on when we experience anxiety. So, yes, anxiety is the anticipation of a future threat. But when that threat occurs, often all these things are going on in our mind and in our body. So, let's talk about when anxiety is actually a problem. Because, if we're hardwired for anxiety, everybody feels it from time to time. So, what is the difference between, just experiencing anxiety sometimes or, a little bit of it versus, when is it actually a problem where you might want to seek some help for it? So, anxiety is a problem when it happens when there's actually no danger, when there is no risk to harm, or at least the risk is extremely low. So, for instance, I know a lot of people that have a hard time going shopping or going into a grocery store. And it's even different now, of course, with the coronavirus. People might have different fears or thoughts or worries about going into the grocery store, but that can be it's a pretty common one that people experience. So, I would say that, coronavirus aside, in general, it's not dangerous to go to a grocery store. You're going to walk around, you're going to see people, you're going to buy some food, and you're going to leave. If grocery stores were actually dangerous, they wouldn't exist. We'd have some other means to get our food. So, if going out shopping or going to a grocery store is something that you're fearful of, then, anxiety might be a problem in your life. Another factor is when anxiety occurs more frequently than we would like. So, like I just said, anxiety is going to happen. It's a common emotion that people experience connected to fear. So, we kind of need it. But if that amygdala in the central part of your brain is going off regularly, so daily, multiple times a day, or even like every other day or so, that just might be too much for you. That might be more frequent than what you want. Also, if anxiety is very intense or very distressing to you, perhaps to other people in your life, but if it bothers you, then you might want to do something about it. Only you can be the judge, in terms of how bad it is. So finally, if anxiety actually interferes in your life somehow, or it prevents you from doing what you need to do or what you want to do, then it might be a problem. If you need to buy food and a grocery store is a place to get it and you can't get there, that might be a problem. Or let's say you have a child in some kind of event. If you can't go watch your child in the event because maybe you're afraid of driving there, or maybe you're afraid of being around other people, you're wondering what they're going to think of you, or maybe you don't like crowds, you don't like the feeling that you can't escape from going into a place or a setting, and you really want to see your child perform in some situation, then that might be impacting your life. Or let's say you really would like to get a job but your anxiety is preventing you from leaving the house or even, meeting with a potential employer, and it's preventing you from doing the things that you want to do in life, then it might be a problem. But again, it really is up to you to decide when it is a problem. These are just some ideas to get you thinking about it. And the other thing I'll mention is that anxiety is different for everybody. So, sometimes anxiety is very specific about specific things or places or situations. Maybe it's a fear of snakes or fear of heights. And for other people, it might be things like having panic attacks, an intense feeling kind of mimics that fight or flight response. If you have those and you're fearful of having those, or you're fearful of having those in public, you know, then you know then that might be a problem for you. Other people, their anxiety experience is that it occurs all the time. It's about everything and anything. It's just constant worry about various things. So, anxiety is extremely broad. And yet, I think it's good to just have a general understanding of some of the things that I've talked about so that I guess we all realize that we all have a common experience, even though anxiety can look very different for each person. Okay. So, you might be thinking, or your experience might be that anxiety is all bad. You hate it. It's intense. It's distressing. That amygdala is going off in your brain all the time, and it's interfering in your life, causing all kinds of problems. So you're probably thinking there's nothing good about that. That might be your experience. But before I end this video, I do want to talk a little bit about some advantages of anxiety, because there are some. Um, so, anxiety isn't all bad. There isn't, so anxiety is not all bad. Sometimes it can actually be helpful. So, if you were listening to the earlier part of the video, hopefully you got that anxiety keeps us alive. It actually protects us. That's what it's there for. It needs to be there to protect us from both physical and emotional danger or suffering. So that's actually a good thing. I like to think of anxiety as pulling over your warmest, coziest, fuzziest blanket and putting it around yourself. That's what anxiety is. It protects you. Who would want to get rid of that part? And like I said, if we didn't have that protection part in us, maybe we would walk out in the street and not care if there was an oncoming vehicle right in front of us. We need it. Yeah. So another way that anxiety can be helpful is that it can motivate us. It can help us get prepared. It can help us be productive and even creative. And I don't think we would want to get rid of that part. If we were going on a multi-day backpacking trip, we probably want just a little bit of anxiety so that we're prepared, so that we have everything in that pack that we need. We want to have all our survival gear. We want it to be light. We want to make sure that we remember everything that we can, because once we're out there, that's all we have. So we need a little bit of anxiety to help us get prepared. That's one example of how it can motivate us. But sometimes it can really sort of kick us into high gear to get going. We can think, I can think when I have deadlines to do things, and I'm feeling a bit anxious because I'm not done yet. That anxiety, and all those hormones going around your body actually gives you a little bit of energy to get things done. And sometimes I appreciate that, and sometimes I wouldn't want to completely get rid of it. So I'll keep that part. So finally, I mean, you might think of some other ways anxiety can be helpful. And I know some people that I've worked with, they definitely have thought of other things. But these are in general some of the helpful things about anxiety. And so the last one, which I can relate to, is that anxiety can really push us to perform at our best. And often people with anxiety actually have pretty high expectations and high standards. And so anxiety kind of gives you that bit of a boost to work really hard and do a really good job. And I think, well, if I didn't have anxiety, maybe I'd have super low standards, or low expectations. And then maybe I wouldn't do the things that I do. So those are some of the helpful things about anxiety. And so, if we were to totally get rid of our anxiety, we would be getting rid of these things too. And like I said, I know for me personally, I wouldn't want to. I like some of these things. So rather than thinking about anxiety as, all or nothing, or like a button that you press or you don't press, or a switch that's like on or off, I want you to consider a magic dial. So, a magic dial is a dial that actually gives you control over how much anxiety you want to keep and how much you want to let go. So it can let you kind of hang on to some of those good things, those things that you like about yourself or like about anxiety, and it lets you let go of all the disadvantages, that uncomfortable feeling, the stress, the exhaustion, the tension, maybe to let you let go of it, some of those things. And so, a dial, you can manipulate any way you want in any circumstance that you want. I like it because it's more flexible. And of course, we don't actually have a dial, but it's just a dial that kind of exists in your mind that gives you permission to keep some of your anxiety. So the goal is not to wipe it out. And in fact, hopefully you learn we can't wipe it out. We don't want to wipe out anxiety. We want a little bit of it. But how much you actually keep is totally up to you. And I guess what we've found is that if we present anxiety in this way as a magic dial, sometimes it can motivate you to make some changes and to help you get unstuck. Because if we totally get rid of our anxiety, that can often feel very overwhelming for people. And then when we do that, we're not honoring all the good parts about anxiety. So a dial does both: keep the good, let go of some of the not so good. So hopefully now you have a better understanding of what anxiety is, what's the purpose of it, the function of it, why we have it, when it might be a problem, and what are some of the helpful things about anxiety. So if you're interested in finding more about what to do about the anxiety, how to get rid of some of it, stay tuned for the next videos because I'll talk more about some things that we can do with our behaviors to sort of crank down that anxiety, as well as how we can change our thoughts. Thank you.